Hi, everybody. We are going to get started momentarily, just allowing those who are attending as a public member to our Disability and Aging Community Living Advisory Committee meeting today to join us. So give us a moment as we allow those attendees to upload to the Zoom and get connected to their audio.
Yeah, this is Jeff Tom. I'm not sure how to update myself on the webinar platform. So just saying.
We'll have a staff
I don't
member
care
here
if
at
I'm me,
CDA
but some
update
people
you,
might.
Jeff.
What?
We'll have a team member here at CDA update your name.
Okay, thank you.
Okay.
I got you, Jeff. I'm doing it.
All right, let's go ahead and get started. Welcome. Today is August 14th, 2024. We are here for the Disability and Aging Community Living Advisory Committee meeting, also known as DACLAC. Next slide. My name is Jackie Tompkins. I serve as the project director here at the California Department of Aging for the Master Plan for Aging. And I'm going to walk through just some welcome and logistics for today's meeting via Zoom. Today's meeting is by webinar or telephone only. We do offer live captioning through Zoom, as well as have two members providing American Sign Language interpretation throughout today's webinar. Following today's webinar and meeting, we will be posting the slides, transcript, and recording to the California Health and Human Services Agency Master Plan for Aging webpage. And as a reminder for our committee members, as well as if you're an invited guest or a speaker/panelist, please take a moment to update your name in Zoom by clicking the upper right-hand corner. You'll see 3 dots. Click there and select rename. In terms of some basic meeting operations for today, the Zoom chat function is enabled for our committee members, state staff, as well as the California Department of Aging staff who are handling the logistics, as well as the invited guests who are sharing any type of meeting resources and information. Those of you who are attending as a public member, you will be able to view the content shared during the chat. However, the chat and question and answer functions are not enabled for comments and questions for public attendees. We do have time on today's agenda. I believe there's 2 10-minute periods in which we'll open it up to any public comment. And in the event you rather write your public comment to us, you can email us at engage@aging.ca.gov at any time or even following this meeting. Next slide. When we get to those 2 public comment periods, if you are attending by phone, you will want to press *9 on your dial pad to join the line. I will announce the last 4 digits of your phone number and I will unmute your line. And you'll want to make sure you're unmuted on your end as well. Public attendees who are joining this webinar via Zoom, you will want to click the raise hand button on your Zoom ribbon, and I will again announce either your name or the last 4 digits of your phone number and unmute your line. And as a reminder, public comments will need to be 2 minutes. I'll activate a timer if Zoom is working properly to ensure that we allow everybody sufficient time to provide their comments. Next slide. So we are here for the Disability and Aging Community Living Advisory Committee, and the purpose of this committee is to advance community living, inclusion, and integration across California. We use the acronym DACLAC for this committee. DACLAC will ensure the involvement of individuals with physical and intellectual disabilities, older adults, and other partners who provide services and represent consumers. The DACLAC also advises our California Health and Human Services Agency, in addition to other state entities, on community living policies and programs. And this includes, but not limited to, long-term services and support, transportation, housing, and employment opportunities. The following slides are just showing you the number of DACLAC committee members who are a part of this committee. numerous people throughout the state, again, representing older adults, people with disabilities, as well as caregivers. So just want to give a welcome and thank you to our DACLAC committee members who dedicate time, resources, and their subject matter expertise and lived experience to this committee. We have a very robust agenda today. Shortly, I'll be turning it over to Director Joe Xavier from our Department of Rehabilitation to do opening remarks. And then we'll also have an opportunity to talk about equity at the center of state and stakeholder efforts. I'll have some time on the agenda where I will walk through our upcoming Master Plan for Aging Day of Action. And then the rest of the agenda will focus on hearing some of the priority areas that our DACLAC subcommittees, Home and Community-Based Services, Housing, and Transportation, are looking to uplift and elevate to inform the next iteration of the Master Plan for Aging initiatives. So that is our agenda today, is hearing from those subcommittees as well as some opening remarks. Next slide just shows kind of the rest of the agenda. It's pretty robust. As noted, we do have time for 2 public comment periods. Those will be about 10 minutes each. And we also have a 15-minute break built into today's program. Next slide. All right, getting started. I do want to welcome Joe Xavier, our director at the California Department of Rehabilitation, to provide us some opening remarks. I am going to spotlight you, Joe. Perfect. I think we're ready to go. And if you're able to unmute yourself, that would be greatly appreciated.
Can you hear me okay? Hello?
We sure
Yes,
can.
we can hear
Thank
you.
you,
All right.
Director.
All right. So technology. So Jackie, thank you. First of all, good morning to all of you, wherever you may be in California. Members, thank you for the work that you continue to do. To our co-chairs, Hagar and Sherry, and to my state co-chair, Susan, appreciate the leadership that goes into continuing the work of this committee. And I would be remiss if I didn't recognize Labor Day, which is just around the corner. It is hard to believe, but we are on the doorstep of September. However you celebrate Labor Day, may it be safe, may it be restful. So just wanted to lift that up. The work of this committee is very important on many different ways. Jackie just touched on it. But as a director, and for all of our directors and all of the staff that work on the programs and services, hearing directly from our community, hearing directly from you, getting your best advice and your best recommendations is invaluable to us to continue to advance programs across a wide range of departments and across a wide range of services. We do have a very packed agenda. Very much looking forward to hearing from all of the subcommittees and all of the various presenters. So I will keep my comments short, and I will turn this over to Hagar and to Sherry to take it from here.
Thank you, Joe. Good morning, everyone. Sherry Burns here. My pronouns are she, her, and hers, and I'm the Executive Director of Silicon Valley Independent Living Center and the chair of the Aging Services Collaborative for Santa Clara County. Hagar Dickman and I are very excited about today's agenda for this meeting. The 3 subcommittees have been working diligently to prioritize 2 or 3 top policy and process recommendations for discussion among the DACLAC members and with public input. They've also been cognizant about the consideration of any policy suggestions needing to include equity and inclusion of all individuals and groups affected by access barriers. We also heard you at our last meeting to be purposeful and deliberate about the importance of equity in all conversations and decisions that impact the work we are doing in this committee. To that end, as Jackie mentioned, CDA has invited the State Equity Officer, Maria Castillo Augusto, to speak with us as we kick off this meeting. And as you listen and engage in the subcommittee discussions this morning, please be thinking about which of the subcommittee's 2 or 3 recommendations should be brought to the very top of the list for further discussion and action planning at the October Day of Action. Thank you. Hagar, would you like to say any few words too before we start off?
Sure. Good morning. Hagar Dickman, she, her pronouns. I'm the Director of California LTSS Advocacy at Justice and Aging. I'm also chairing the HCBS subcommittee this year. And thank you everyone for joining us for this important discussion, and just wanted to uplift Chair's comments and encourage you all to listen closely to the recommendations and really think about which 3 recommendations you think California should prioritize in order to improve equity and access to services in the state and improve community living for all individuals who are living with disabilities and would like to remain in their home. So with that, I am going to, you'll hear more from me later, and pass it on to Marina.
Good morning, everyone. Good morning, everyone, and thank you for having me here today. My name is Marina Castillo Augusto. My pronouns are she, her, and hers, and I am the Equity Officer at the California Department of Aging. Before I begin my presentation, I just want to share a little bit about my background, where I come from, who I am, and again, just thanking you all for time on your agenda today to talk about this very important topic related to equity and embedding it and how we can move together across all 6 committees to just lift it up and elevate it. So I am a Latina woman. I am 5'2". I have medium length hair, and I'm wearing a green blouse today. And I am a daughter of farm working parents who encountered many of the inequities and injustices that I advocate for dismantling in my position and role. I've been with the state for 27 years. I can't even believe it myself. But my beginnings really started as a victim advocate for sexual assault and domestic violence victims in Yolo County. And at the time, I didn't know how important community engagement was in terms of just being able to hear the barriers and, lack of accessibility for individuals who were just trying to get support services and help. And so it was very disheartening and discouraging. I reflect on my parents as well, not having insurance and trying to get me into medical appointments, and the hardship of having to pay, or the hardship of just not understanding a treatment plan and things like that. So all these things have stayed with me throughout my tenure in state service. As I transitioned from a community-based organization or CBO land into state government, I carried that with me, and I wondered, as I moved into a bureaucratic system, how I would be able to influence and lead efforts for the most underserved, underrepresented groups. And it's been challenging, but it's also been very rewarding. So with me in my space and my leadership role, I sometimes am the only person that raises issues regarding language access or accessibility. But I still feel privileged in my role. And so I thank you. I thank you for your commitment to equity, and I thank you for the ongoing support of working together and in partnership. So without further ado, if you could share my slides, please. I'm really eager to tell you about the opportunities that we do have in state government at this time. Like I said, being in state for 27 years, the executive orders, the commitments, the initiatives, the policies that I'm seeing now that can really position our committees, the Master Plan for Aging, to lift the most vulnerable voices to a level that is unprecedented is really exciting. And so here are just a few examples that I wanted to share with you. One is Governor Brown's executive order that really speaks to the importance of ongoing communication and tribal consultation policy to help, design and implement programs that are culturally and responsive to the needs of community, to Governor Newsom's executive order on equity, which really is a call to action to state departments to embed equity frameworks in strategic planning, everything from mission, vision, policy, programming, operations, so that we can serve all Californians. The next is the California Health and Human Services Agency, which established guiding principles that focus on equity, that focus on putting the person back in person-centered, innovation and data. And really, I was happy to see that in May of 2023, they developed their first language access policy, which then influenced the 12 departments underneath California Health and Services Agency to develop their own language access plans. So I'm happy to report that in June of 2024, CDA posted its language access plan on the website, and there's additional work to be done. Obviously, it's just the start, but it was a huge step in the right direction. And the purpose of the language access plan is all about accessibility for limited English proficient individuals and for individuals with that are hearing and sight impaired as well. Then we have the master plan for aging with its 5 bold goals, one of them being inclusion, equity, not isolation, and the number of strategies and goals and initiatives that I think the department is really being intentional about weaving that equity lens throughout their efforts. And this can be done through the committees, and it can also be done by other stakeholder engagement endeavors, which I will speak about momentarily. Next slide, please. So having said all this, how do we continue to integrate equity and the lived experience lens across the lifespan in the MPA? It's not an easy job, and you all have done this work longer than me in the space of representing the voice of older adults, people with disabilities, and caregivers overall. And so in thinking about remaining centered at the heart of our work, which is really the people we serve, we wanted to even be more intentional and expand this a little wider. And what I mean by that is, within our committees already, we have individuals that have come to the table with lived experience in their background, and they represent those in the community as well. But we thought about if we could lift up an aging and disability lived experience advisory body. Next slide, please. So this was a proposal that we worked on, and I'm very happy to report that it has come to fruition in the sense of being able to have a standalone aging and disability lived experience advisory board that would be representative of underserved and underrepresented groups. And we're really trying to reach those who aren't accessing services and those who are in services but are encountering barriers, because unless we're able to identify our gap areas and unless we're able to hear the perspective of those that will help us continuously improve and build quality into our efforts, this is very key to our next stage, our ongoing work. And so I am here today to just wanting to see how we can work in partnership as we lift this and we move forward with this idea concept and putting it into, operation. And so next slide, please. This schema here really is based on, having the Aging and Disability Lived Experience Advisory Board at the center of the work. Although the Aging and Disability Lived Experience Advisory Board will be working closely with the Equity Advisory Committee on Aging and Disability as its primary point of contact, we really want to encourage and will facilitate ongoing communication with the various committees as well. I will be working closely with all the committee leads to ensure that they are kept up in every step of the process, be it from establishing the charter to recruitment and outreach of the members, and what needs are being lifted that need to be, circulated and discussed with the various MPA committees. Next slide, please. So in terms of the ad lead next steps, I wanted to mention a few things. So the principal consultant is Maya Sandifor, and she is with Change. Gosh, I'm trying to blank right now. Change Group Consulting. And as I mentioned, she will be partnering not only with CDA and with the Equity Advisory Committee to define the process and parameters and logistics, as I mentioned, just the parameters of how we're going to lift the ad lead. And then here's just a small timeline as far as member recruitment and the launching being in spring of 2025. Next slide, please. So at this point in my presentation, I just want to see if there are any questions that I can answer, and also how just your ideas and thoughts and moving forward in the best way possible with the ad lead, and then also hearing any equity kind of recommendations, be it at this meeting or be it you email me. I have an open door policy, and I'm always happy and eager to engage. Thank you very much for your time.
I see Hagar has her hand raised. And then Marty, and then Kim Mills.
I really appreciate the advisory council for people with lived experience, and especially your sort of uplifting the importance of identifying barriers and access to services. And I'm hoping you could speak a little bit about what your vision is for how those advisory boards are going to be operationalized together with or interface with the gap analysis that both DHCS and CDA are finalizing.
Thank you. Yes. So what we're doing at this time is I'm in consultation with our leadership. And so as we lay out the plans for Maya and group, we really want to be intentional about what's already happening. So thank you for bringing the gap analysis. And so we will be in consultation. We will identify priority areas. We will also, like exactly what you're doing today, get feedback from each of the committees on where we should prioritize and concentrate our effort in. We are also looking and just researching across other lived experience advisory boards and how cross communication and collaboration, shared lessons learned, what we can do better. And so we welcome any of those suggestions as well. More to come. I'm happy to, at some point, when we finalize more of these details, to come back to the committee and maybe include Maya so that we could respond accordingly. Thank you.
Thank you, Marina. And Marty, and then Kim Mills, and then Andrea Robert.
Marty Emoto, I'm a father and family member, and also with CDCAN, California Disability Aging Community Action Network. First of all, Marina, I welcome you to the department, and really, I was really encouraged and that they brought you on, and really loved your presentation and your history and the way that you're presenting this. So you got a lot of friends out here that want to work with you. And I just appreciate the fact that you're there, and that says a lot about the department, and also the other agencies too. My question is, what role, and I would encourage that there is a role for you and the department in terms of the equity issues and other efforts by the state that may be in another department, but that's going to impact people who are older. So I'm specifically referring to, but other examples, on the master plan for developmental services. The problem with all of us, and it's not just the state, but as advocates too, that we are siloed in our thinking and our approaches, even when we deal with problems. My sister was an older person. She had developmental disabilities, and she received services from an array of systems. But back then, the Department of Aging probably wouldn't have thought of her as a person that they should have anything to do with. I don't mean that in a mean way, but she has a right to expect help from the Department of Aging, just as the other people, you know. So I just want to know, in terms of equity issues, because I think it's really important, of what role does the department, and you're probably not going to be able to answer this since I'm saying the department, will play in working with the master plan on terms of aging issues that deal with people with DD, but also the family members. Like, I'm 70 years old and I'm a caregiver to my son who has Down syndrome. And there's a lot of caregivers out there who are older. And so the issues of equity cross system lines. And so that's my question to you. You probably can't answer because there's a little bit of a policy thing in there, but I'll throw it back to you. Sarah always knows that I ask those kind of questions.
I appreciate that, Marty, and it's something. So I've worked in public health at the state level, behavioral health, and it's the same kind of thing where operating in silos. Department of Healthcare Services is, doing this, the Department of Public Health, and what I come to realize and understand, be it victims of crime or, in the behavioral health sphere, the inequities and disparities continue to impact and plague pretty much the same communities. So people of color, people with disabilities, and so on and so forth. And so one of the things that I keep broaching, Sarah, we keep talking about is alignment of effort. And so also social determinants of health, so there's a lot of effort in that space. And I think that one of the things that I love about CDA is that they don't shy away from reaching out to Department of Healthcare Services. I mean, we have to understand what our lanes are because of funding, because of the structures that are already in place. But it's also important for us in this committee, and this is something that I would really love to have further conversations when we look at institutional and structural changes that need to happen, because sometimes these silos perpetuate the inequities and disparities. And so that conversation is a big conversation, but I think there's something to be said to being able, and maybe through AdLib and through the support of the Office of Equity, that some of those conversations can at least happen with other departments or decision makers. So thank you, Marty.
Great, thank you. And I'm mindful that we're a little behind on time, but these are very important comments and questions. So we have 3 people with their hand raised, and I'll turn it over to you, Kimberly Mills.
Thank you, Sarah. And welcome, Marina. Very excited for your position and very hopeful and excited that this is a priority of the governor, because equity really is an important part. My name is Kim Mills. I am CEO of A Better Life Together. We're a provider agency through the San Diego Regional Center, through DDS. We serve adults with intellectual and developmental disabilities. Also, we do a lot of education and outreach to our underserved community, African American in particular. And what I'm passionate about is linguistic competency, because that term is thrown out a lot. And I just want to emphasize that it's more than just making sure that people are bilingual. People communicate differently. And so when we interact with our African American community, sometimes us moms or dads, we're frustrated. So we might come across as being hostile or yelling, and that's not the case. And so we don't receive services because people don't understand how we communicate and maybe where that comes from. So hopefully there'll be some efforts into doing some trainings and some awareness. I had a son that passed away at 20 of a seizure. He had IEPs in school, and I remember my first IEP as a mom. And it's one thing to be a professional to support another mom. When you're the mom, Mama Bear came out, and I got really emotional. And I remember just but just looking at the faces of the people that were in the room and thinking, probably think I'm crazy. And I wasn't, I was just upset and just all of that and really didn't feel supported and had to really kind of stop the meeting and reconvene until I got myself together. Well, some families don't have the time to get themselves together. They just need services and they've been told no. And so I'm hoping that it's very exciting to hear about this new committee with lived experience. And it's because hearing what people go through and how, and maybe shedding the light on it so we can kind of have some trainings or some awareness that if I'm yelling or my voice is a little animated, I talk with my hands a lot, I'm not hostile, I'm just frustrated. And so hopefully that will come into play as well. So welcome and so excited. Looking forward to the impact that your department will have on our industry.
Thank you, Kimberly, and my heart goes out to you. Deepest condolences for your loss. I can only imagine. And so we have probably experienced the same thing. I speak with my hands. I get very excited about things, and I'm Mama Bear too. And so I worked with a group of African American influential leaders in the development of a mental health report. And the title of it was "We Ain't Crazy, We're Just Dealing with the Crazy System." And it was so controversial within state government because, in behavioral health, you're using crazy, and people were thinking it further stigmatizes people. But this was the title that the community came up with because that's exactly what they shared, is that going into systems, behavioral health counseling, whatever, and being so expressive, that they were being diagnosed in different ways. And so thank you for raising that other lens of linguistic responsiveness and understanding. And I'm hoping to implement or institute some training in the future. And maybe some of you that are subject matter experts can partner with me, or we can do something together on that. So thank you.
Thank you so much. And I'm just mindful, I don't want to cut into our subcommittee time, and this is all wonderful. We have three more, let's see, Andrea, Kathleen, and Peter. Welcome, Peter. Andrea, over to you, and then we'll just go back over to our Home and Community-Based Services Subcommittee. So, Andrea.
Great, thank you. Just real quickly, given the time. So, Maria, thank you so much. Thank you for sharing your personal story. It really helps as a person with lived experience to see what type of experience and personal experience a person have. They had these committees. So thank you. I totally agree with you, Kimberly, in regards to the language barrier. This can also happen as a committee members when you're frustrated coming off at a certain tone and you're really not. It's just sometimes it's our language. Also, just curious to know, you don't have to touch on it, how they would how will they begin the recruitment process? Will they consider diversity? I'm talking true diversity in regards to this lived experience committee. And what was my other question? I think that's pretty much it. So just thank you so much for heading up this committee, and hopefully it would be inclusive of people with lived experience, because sometimes we share these committees with professionals, which is really just equally as important, but it really helps to have our own committee because there's so much experience it's so much experience that we bring, and definitely within the lived experience committee, someone that's about navigating systems so that we can help each other within the committee. So thank you.
Thank you, Andrea. And yes, I'd like to explore that. I've heard that quite a bit. True diversity, true representation, and so again, being very intentional about the membership and having that true piece come out in terms of someone that actually speaks to the community, and that community can also, raise their concerns through this member as well. So more to come, and I may reach out to you to learn more about your definition of true diversity. Thank you.
Thank you.
Thank you. And we have one final hand up, Peter Mendoza. Thank you for being here, Peter.
You're welcome, and thank you, everyone. Can you hear me okay?
Yes.
I'm Peter Mendoza, and my day job is a community program specialist with the State Council on Developmental Disabilities. However, in this role, I'm speaking as a individual who uses long-term services and support. I think when you talk about equity, you have to talk about service delivery as well. You have to put equity in each program. I want to honor the state for the great work that has been done over the years, but there's still gaps. There's people who can't get services. There's people with mental health disabilities who are having difficult getting the help they need. There's people with intellectual and developmental disability who are also not getting the support they need. People on IHSS and other home care programs have emergencies. People aren't able to come. Sometimes the providers are single parent or they have family emergencies. And there isn't a gap sufficient when someone doesn't show up or can't provide the service. And we have people right now who have gone into facilities because they weren't able to access or get the care they need. And we all receive emails from people expressing those concerns. So we all have a role in addressing the issue. And again, I want to honor everyone for their work, but I want to keep us on the prize. Okay? The goal of Olmsted was to keep people from having to go to institution and to allow those who are in the institution a way to move back in the community. But it's also the role to ensure that folks with disabilities, older adults, children of all ages can live life just like those without disabilities. So that is the standard we need to set for ourselves, that we want to live life just like those without disabilities, to be able to live, work, play, recreate, and do everything everyone else does and have the same opportunities. So I really want to bring us back to that in our discussions. I'm really glad that there's a committee on lived experience, but a lot of the barriers that people experience are particularly experienced by those who are low income, people of color, and people who have difficulty accessing services. I want to talk about one more thing which was brought up. I too sometimes get accused of raising my voice or yelling because I have CP, and part of my disability is I've learned how to control it better over the years or manage it. But part of my disability is when I'm under stress, my body tightens up. People sometimes don't want to listen. And those are the folks that can't get services. We get labeled. We all have files. So I want everyone to hear this and really make the goal that everyone should be able to live their life just like those without disabilities. I've just turned 58. I started this work when I was 16. And we've come a long way, and I honor folks, but we still have a ways to go. And I appreciate each of you. And please take that into spirit. Thank you very much.
Thank you, Peter, for that reminder. It's absolutely the truth. And we can't forget about the gaps that still, and the standard that you mentioned. So thank you so much.
Yeah. Thank you. And I just want to thank you, Marina, for this really, really important discussion and for the wonderful comments and personal insights of our committee members. I do want to just double check. Kathy Kelly, you had your hand up and I want to make sure we're not cutting you off.
Well, can you hear me? Because I'm just,
yes.
Yeah. My hand kept getting lowered, but that's okay. Welcome, Marina. I just wanted to make the comment that I hope in this inclusion of consideration of members on this committee that there is at least one or two family members involved, because we always think of the individual, and we should. The individual is at the center of the care, but for the population that we're dealing with, largely dementia population, and also within the families that we serve, which is quite diverse. It's really a family systems issue. It has individual components to it, and they should be front and center, but it's also a family system issue. And I think it behooves to think about it in slightly broader terms, because if the person's not living independently or alone, they're usually within a family system, and it would be good to have their voices around the table too.
Thank you, Kathleen. That's very important, and absolutely, we will keep that in consideration, and all the support's needed. Thank you.
Wonderful. Thank you. These have been extremely insightful discussion. Really appreciate this committee and these reflections, and we will take this feedback as we move forward with this Aging and Disability Lived Experience Advisory Board, and just appreciate you, Marina, and the work you're leading. At this time, we're going to hear briefly from Jackie, who's going to give an update on the process for the MPA stakeholder recommendations and the day of action. Jackie.
Hi, everyone. Again, Jackie Tompkins, Master Plan for Aging Project Director here at the California Department of Aging. I indicated earlier when I did some opening remarks that we're going to have the MPA stakeholder committees, including DACLAC, be able to share some of their priorities and recommendations at our California for All Ages and Abilities 2024 Master Plan for Aging Day of Action, happening this fall, October 8th, here in Sacramento, California. Did want to do a final plug to all of you that are committee members, or maybe those who are consumers or public members who represent older adults, people with disabilities, and caregivers, to be sure to register for the event. And do want to thank our philanthropic partners for providing us the support needed to put on this event. Moving on to the next slide. Just want to share with all of you of what you can expect as a committee member or attending as a public member at this event. We're really looking to hear from our stakeholder committees on some of the highest priority issues that are facing Californians today. As we look to update and refresh our Master Plan for Aging initiatives for the years 2025 to 2026, we want to ensure that we continue to focus those priority initiatives on equity and lived experience, and also additional recommendations that the committee members and stakeholder committees have. This is also going to be our opportunity that we're going to highlight the progress that the Master Plan for Aging has made to date, and also do a renewed commitment to California's Master Plan for Aging, as we're essentially hitting that mid-year point of our 10-year blueprint. And throughout the day, we're looking to also invite and engage diverse partners. The Master Plan for Aging embraces a whole of government approach, as well as a whole of community, whole of society approach. So we have invited not only our administration leaders, legislative leaders, we have also invited some national leaders to attend this event as well, to hear some of those priority issues and topics. Just given the time, I'm going to go through my slides a little bit quicker to make sure we have sufficient time to hear the recommendations from the subcommittees. But just while we have not posted the agenda quite yet, did want to give you an overview of what to expect on the day of. We're looking to pull together a panel that can speak to some of that lived experience, help us ground the day and start the framing with the why we do this work. What are the challenges, the barriers, as well as what are some of the successes consumers have experienced with systems and programs and policies. This will be also the day that DACLAC, including other MPA stakeholder committees, have the opportunity to verbally share out their recommendations for state review and consideration. And then we're going to close out the day being able to talk about how we continue to advance systems change through the Master Plan for Aging by speaking with some of our policy and budget staff. And then we have also embedded some networking opportunities throughout the day. This includes a post event networking reception. So just wanted to let you know that, do a plug today that please sign up to attend the Day of Action, especially if you're an MPA stakeholder committee member here at DACLAC, but then also wanted to give you an overview of what to expect for the day. I think I saw the registration numbers. We're looking at over 700 people, 400 attending in person with over 300 attending online. And based on the numbers, I feel like DACLAC has some good representation that has already registered for the conference. So thank you for that. And I look forward to hearing today about the stakeholder committee recommendations, and then further hearing those recommendations at the California for All Ages and Abilities Day of Action this fall. I'll pause to see if there's any immediate questions, but also recognizing that we're a little bit short on our agenda and want to hear from the committees. Any questions that I can field at this time?
It looks like Michelle Rousey had a question, or she just made a statement about the importance of seeing that those who serve on the consumer panels at the beginning of the day want to be the importance of compensating them for their time on that. So absolutely agree. Jackie, do you want to make a remark about that?
Yeah, we are working with the Center for Healthcare Strategies and Solutions to help us identify appropriate people for that panel, as well as be able to fund them for their time and lived experience and contributions to the day and further the master plan for aging and other programs and services. So thank you, Michelle.
Yeah, I just also want to note that what's exciting about this panel is that these are consumers who were engaged through the consumer listening sessions of the Home and Community-Based Services gap analysis. So they had participated in that effort and really was excellent reflections that they all had. So we are working with the same group to bring them back to speak at the Day of Action. So looking forward to that. So sorry to cut off. Jeannie.
Yeah, thank you, Jackie. I'm not sure if you mentioned this, but did you actually state the stakeholder recommendations, or were you just referring to those recommendations related to this committee? And is it just the panel?
So if I'm understanding your question correctly, right now, all of the 6 MPA stakeholder committees are developing their recommendations to put forth to the state to elevate through the master plan for aging. So today we're going to hear some of those initial priority areas that at least DACLAC in the area of home and community-based services, transportation, and housing have been working on and will elevate at the Day of Action. And likewise, the other MPA stakeholder committees, whether that's equity, research, Elder and Disability Justice Coordinating Council, they're also going through the same exercises. And they're actually going to be submitting their recommendations to us, I think next week. And then we'll be making those available for attendees, as well as sharing them with our state partners.
Great. Thanks so much, Jackie. That clarifies.
Okay. Thank you. Right. Shall we move on to Hagar to kick off the recommendations, specifically home and community-based services, but she might want to make some remarks with regards to the full committees. So let me get you spotlighted, Hagar, first, and remove some spotlights.
Just sitting up straight now. So. Yeah, you can go ahead and spotlight the whole committee, I think, because I'll make remarks at the end. So I think we just, as the HCBS subcommittee, we had put together some recommendations that fall into 3 buckets. We have recommendations that are focused on access, navigation, and quality. And so I wanted to sort of to introduce them. When the first slide is going to be focused on improving access to HCBS by removing financial and administrative barriers and engaging stakeholders. And I wanted to call in the HCBS subcommittee so that they can weigh in and present the different recommendations and explain the thought behind them, and also provide some perspective as to how these recommendations improve access to HCBS. Is Janie on the call? It's a little hard with the Naomis.
if you have the committee members' names, then we can,
Sure, it's Janie Whitfield and Megan Burke, Sabrina Epstein, I think is Barbara Hanna, Corinne Jones, Jeff Tom, Kimberly Mills. We're a big group. Michelle Rusi. Am I missing anyone?
I'm trying to get everyone spotlighted. So I have Megan, Sabrina, Jeff. I heard Kim Mills.
Oh, and Andrea as well, and Marty. Andrea Roberts and Marty Amato. I think I'm missing Janie. I don't know if Janie is on the call. Janie, are you here? Okay, maybe Janie's not on. So I'll start us with share of cost, and we'll go from there. So our first recommendation, and I think our top recommendation under access, is implementing share of cost reform. And this is really a key recommendation for access to HCBS. We know from data published by the Department of Healthcare Services that we have around 61,000 individuals who are in share of cost Medi-Cal, but only 8% are actually meeting their share of cost. And the reason that individuals generally are not able to meet their share of cost is because spending down to $600 a month income on a monthly basis is just too little for people to live on, and it forces people to decide whether they can meet they will be able to meet their basic needs, or whether they will seek access to HCBS. So we really encourage the state to prioritize implementing share of costs, both through the budget process and legally through the statute. We know that the statute passed a couple of years ago with budget trigger language, and so we encourage DHCS to work with the governor's office and the legislature to put this into the budget. And I'm hoping that Andrea, are you here? I'm missing her on that list here. I think she wasn't.
Yes, I'm here. I need to
You're here?
rename myself.
Oh, okay,
Yeah,
great.
I'm sorry. I had to jump on another computer because mine's, I don't know what happened. But yes, would you like me to share for a minute?
Yeah, I'm hoping you can share, because you're both a person who is using IHSS and you're also an IHSS advocate. I'm hoping you can maybe share a little bit about what you've seen as the impact of the share of cost policy right now on people who need IHSS.
Okay, thanks. So yes, my name is Andrea Robert, and I utilize IHS right now, but I am Medi-Medi, meaning I am double cover Medicare, Medicaid. So I don't have any personal issues, but I help a lot of people through a program called HICAP, which is a organization that is on the back of the Medicare book. And so one of the biggest problem, I just helped someone, this is a real case study. We applied for Medicare, and the person's share cost was $1,000. This particular person retired, paid into the system. She ended up needing in-home supportive services because it was a hit and run situation. Her sister was killed. She lived, had to have multiple surgeries. Now she's in her home at 85 years old, cannot get around. Her share cost, once she did the paperwork, was $1,000. So she's not able to get in-home supportive services. We talk a lot about the spend down. Honestly, it's unrealistic because even when we get calls, some of the questions people ask in regards to Medi-Cal is that how do they spend down? Well, if a person is receiving Part C of Medicare, not original Medicare, but Part C, which I receive Part C, there's very, very little out-of-pocket expense. Sometime with the HICAP counselor may suggest, which you have to be very careful, is for them to maybe pay into a longer extended vision care or dental care, but honestly, that may be maybe $50 a month. And so at the end of the day, the person have no way of spending down to get the care that they need. She can't spend down $1,000. And like I said, sometimes we talk a lot about spend down, but realistically, if you're receiving Part C of Medicare, there's really nothing to spend down because most of your healthcare expense is pretty much covered. Your Part D, prescription drug, most of the people that pick Part C pick a Part C based on the premium associated with the healthcare program, which is very small, very limited, very few healthcare programs like the Humanas or the Kaiser have a premium. So it's really hard to spend down. And so we're hoping that, I know it's walking a thin line because of the deficit, but somehow either raising the poverty level or increasing it so more people can qualify for needed IHS services. But something needs to be done because I see people, I live in a senior apartment, and I see people barely making it to the laundry room just to take out their trash. And they just don't have the help, or their loved ones is just stressed out because they're doing as much as they can. So we really need to look, look at that. And you guys have done great work, but this is why we need advocate like myself, because we can share that even though the spend down may be an option, it's not realistic. So thank you guys for allowing me to share.
Thank you, Andrea. And Michelle, did you want to weigh in also?
Yeah, sure. The share cost for IHSS and your Medi-Cal portion, we've been advocating for change for this for more than 20 years that I know of. And it puts an undue burden on our seniors and people with disabilities who have that high share of cost. There's no way you can live on $600 a month at this time and age, even with full supports on the backside with housing and everything else. There's just no way. It's just unrealistic to expect our seniors and people with disabilities. And what ends up happening is they do have to make a choice. They have to make a choice of whether they have the care they need or they have food and housing and their needs met on the other end. And what gives out more times than not is they choose not to have the share cost and not have the Medi-Cal. And then we're having them end up in institutional care or other care that's more expensive, and that's not okay either. And so this absolutely needs to be addressed, and there's no time like the present. We can't afford more years of not being addressed. And going forward, as we have a huge amount of seniors coming into the system and needing more services, we need to address this now. Thank you, Heather.
The next sub recommendation that we have here is around presumptive eligibility for HCBS and providing prompt coverage, as well as projecting costs for and implementing a provisional plan of care that would allow that. And I can kind of do a quick explanation. And then I think Barbara Hanna is on here, as well as Corinne Jones, and they can maybe provide some provider perspective on these. Prompt coverage we have right now in California for individuals who are in hospital, receiving hospital care. And really what that allows people to do is to get Medi-Cal eligibility based on self-attestation so that they can access SNF services. And the HCBS subcommittee is recommending that policy be expanded to people who need HCBS services as well, so that they can get immediate access and payment to providers as they are going through their Medi-Cal eligibility process. And then the prompt coverage recommendation is meant to lift the burden or the barrier for access specifically to waiver services and to IHSS, which prevents payment for services while individuals are either on a wait list or awaiting coverage or finalizing of their coverage. Specifically for HCBS waivers, individuals might be able to receive services, but they need to go through this eligibility and process through DHCS. And having a finalized provisional plan of care in place, we recommend that a provisional plan of care be put in place prior to finalization. I think if Barbara, I don't know if you're on the call, if you wanted to weigh in on what the impact is on delay payment for providers, that would be really helpful, or Corinne as well.
Sure. Hi, I'm Barbara Hanna. I represent the California Association of Health Services at Home, and my paying job is I run and operate a home health agency that is an HCBA waiver program. And we are also a CCA, and we assist with assisted living waiver, AIDS waiver. So we're in multiple different long-term care programs and been managing them for, well, since the beginning. Many times the providers, when we are waiting, and this is not just providers that are getting paid by Medi-Cal directly, such as myself, but there are family members or WPCS workers. There's different workers that, as we're waiting for eligibility to be approved or for the home and community-based programs to be approved, the families are trying to recruit workers to help work, whether it's an IHSS worker, whether it's a WPCS or a waiver personal care service worker. And as they're waiting, it could be months. It could be 1, 2, 3 months before the approval for that client or that participant is finally approved by the state nurses. And so you're asking somebody to not get paid for 30, 60, 90 days. So agencies like myself can weather that a little bit better, but it means in some cases that I have to get bank loans to meet my payroll and pay my taxes. And June of every year, the state budgets, we end up not getting paid for several weeks until the budget has been completed and we get through the July 1 timeframe. And so the state budget is being balanced on the backs of multiple providers. And to give you an example of how bad it is, we just received $1.5 million check for services for HCBA that represented May, June, and July services. Or excuse me, it was probably April, May, and June services. And so luckily we have the capacity to do that, but not many smaller agencies can do that, and certainly individual people. So I think having some type of reform, some type of process that we can speed up the payment to providers is essential. And Governor Newsom has also promulgated some new legislation that's supposed to maybe go into effect on January 1 now of next year, where all healthcare facilities, and this is residential care facilities, hospices, home health agencies, anybody with a state license to provide healthcare, the minimum wage for all people employed is $25 an hour. There has not been a pay rate increase for home and community-based alternative waiver people since 2018 for HCBA. And yet we all have been talking about the cost of insurance and food, etc. So there's this disparity between what's being paid, what's being expected. I just finished a call from high-tech security that we're supposed to also be responsible for, and doing assessments. And some of the recommendations that this assessment that we did it for our company came back with, well, you need a full-time person to do this and a full-time person to do that. And that costs a lot of money. And I have no budget to accommodate for that. And so I was asking them, well, what else can I do that doesn't cost me that much? Because I don't have that luxury. My HIPAA compliance officer is also my office manager, and they're saying, well, we should peel that apart and make it 2 different positions. And I said, I'd love to do that, but we don't have finances to do that. So that's I don't know if that's exactly what you were looking for.
No, this is great. Thank you. Yeah, this is very helpful. Thank you for the provider perspective. It's really helpful to also, especially as we're talking about improving access, provider availability is a really important part of that. And so putting in place policies that support the providers is going to be essential for improving access in the state. I'm actually getting the hook from Sarah, so I'm going to move us on really quickly. I'm sorry, Corinne. I think we'll be able to add comments at the end, hopefully. The next recommendation that we have is creating a stakeholder process or work group on HCBS delivery. That's another access improvement that we believe is necessary, especially as DHCS is considering moving or transitioning waiver programs into managed care. And then I'll move us on to improving navigation. And Sabrina, did you want to speak to this?
Sure, I can cover this one. Our second recommendation is to improve navigation, to develop a no wrong door system that helps consumers access information and spans across programs and government departments, starting with a centralized resource page, which we know is in part already in progress and we're excited about. And we just want to emphasize that the goal of this system should be to remove some of the administrative burden from the consumer and have the state take on the role of navigating all these different services. So it's no longer a full-time job to try to understand which of the many services that you just heard the different consumers and providers discuss that you can use and which work best for you.
My unmute button disappeared. Thank you, Sabrina. And then did you and Megan also want to walk us through our third recommendation about improving quality metrics?
So our third recommendation is related to quality. And when we're thinking about quality, we really thought about how under the same principles that we just discussed with no wrong door, how our quality metrics can stretch across the different systems. And so we know that the Medicaid access rule, which came out this year in April, has quality metrics that are going to be required for fee-for-service Medi-Cal across the systems, whether that's the DD waiver or IHSS or the assisted living waiver. And so we thought this would be an awesome opportunity for the state to standardize quality metrics across the different LTSS systems in the state, not only in Medi-Cal, and that there should be stakeholder input throughout the rollout of the quality measures to ensure transparency and also to make them as effective as possible. So that an example that our colleague Michelle brought up is having consumers who are going to be the ones filling out the surveys, responding to them, be part of the process of what it would look like to actually get good responses on the surveys when you're developing the quality measures and the how of the implementation. And in summary, we really feel like the different silos in the system aren't working for people. And so when we look at quality measures, we want to avoid further entrenching those silos and instead be able to compare quality across the different systems. And I'll pass it to Megan to see if she has anything to add.
Not too much. Thank you, Sabrina. You did a great job touching on the key points. I think it's just, again, reinforcing, the voices of people with lived experience in the development of kind of those, or the selection of the quality metrics and the process for soliciting that data. I think one of the other things we talked about as well is just in the idea of, making the quality metrics, sorry, I can't think of the right word, but anyhow, making sure that we're kind of breaking down those silos and making those quality metrics kind of go across the LTSS system. We're also thinking about how the requirement to report out on waiting lists, excuse me, on some of the different waiver services, and really thinking about developing a crosswalk and a plan to help make those definitions standard across the different programs. So right now there's like different definitions, different timelines, different ways they're reported. And so just kind of standardizing that process across programs as well. Thank you.
That's great. Thank you. And I see we have some comments or hands raised. So I think I'll start with Andrea because you're part of the subcommittee. Andrea, did you want to weigh in? And Corinne as well. So, why don't we start with Andrea and then Corinne?
Great. This is just more of a comment. I'm so grateful to be on the committee and the subcommittee. Thank you so much. One of the, I think, recommendation was to try to get all the HCSBs, I don't remember the initials, all the waiver programs together, because as a person with lived experience or helping someone else, when you go on to DHSS site, you literally have to push on each waiver program to find out which one works for you. So the idea of having them all together under one link would be so much helpful to others, even myself, in the event that my condition progressed, knowing that I can go to one site to see what works for me, because I'm always researching and trying to stay up to date on resources and services. And so, like I said, if you guys haven't already, if you go to DHSS website, you see all these great waiver programs, but you have to click on each one and they all have different qualifications. So thank you guys for doing such great work.
Maureen, did you want to also weigh in?
Hi, yes, let me go back on camera here. Yes, for sure. Thank you each and everyone for all you're doing. I just wanted to share, I'm at Senior Network Services as a program director, and so I'm working with older adults every day. And one of the biggest problems going back to what we were saying about not just HCBS, but the IHSS system as it's set up is so weak and faulty. I have people that have waited 6 months, and from the time that they were approved by Medi-Cal, for Medi-Cal, which we've done the application for Medi-Cal, and then that was sent to get the assessment, which took another 2 months. And then once the assessment's done, and then it comes back and they determine the amount of hours that they're entitled to, and et cetera. Sometimes it's running 5 and 6 months. And in the meantime, unless they are blessed to have a loved one, a family member who can be the unpaid family caregiver, they're just out of luck. And there's got to be a better way. One thing that's going to help is paying people better, because people will jump on the bandwagon and want to become caregivers if they're receiving proper remuneration for it. But when you're paying somebody $13 an hour and they can get $18 an hour, pushing in baskets at Costco or something, it's not hard for them to make the decision which to do. I just kind of want to throw that in.
Thank you, Corinne. I just want to respond to that and say what Megan mentioned about timelines being part of quality. So the new Medicaid access rule is going to require some reporting on how long it takes from getting a service approved to actually getting the service, receiving it in your home. And so what you just described is exactly the kind of data point that we need to understand in order to improve quality of services, because that is just so disappointing to hear how long those waits are. And those are the times where it's more convenient to go into an institution, right? Like that's what happens if you don't have the supports around you. So thank you for bringing up that example. It is exactly the kind of thing that we want to recommend collecting data on across the systems.
And I really like how all of these recommendations kind of come together, both quality measures, measuring the time you're waiting, and then putting in place policies that reduce those waiting times is really what we want to uplift in the subcommittee. Michelle, did you have an additional comment?
Yeah, I actually have a couple. One was on the second proposal in the work group to work with the managed care plans. And I know in the next year that some of those managed care plans are going to be doing case management. And right now they do not have the provisions or knowledge to be able to do that for those of us who are duals. And the system is not in place at this point that can happen. And I really do encourage the work group to get together and start working with them ASAP, and so that they can get that knowledge and be able to work with consumers who need that. I think also just in general, I think that the health plans, although they do have their own advisory committees, I think as we're rolling out new programs and regulations and rules and things like that, that somebody who knows more about those, who should be working directly with the health plan so that they can get their knowledge and and get up to par so that we're not playing a guessing game when it comes down to what information we're passing to the consumer. Thank you.
Thank you, Michelle, especially for uplifting the HCBS work group sub recommendation, because just to give context in case, people on the call haven't attended the gap analysis, DHCS has announced formally that there are plans or that the department is working on plans to transition some of California's 1915C waivers, so the ALW, HCBA waiver, and a few others, into managed care. And as the state is exploring that option, because the individuals using those waivers have pretty high needs and are really at high risk of having to need institutional care, it's really important that whatever plan there is to transition these services gets input from people who are actually using them and from advocates who are supporting them. And so this recommendation is really aimed to put front and center the need for public input and stakeholder input in that process at an earlier point in the process. So really thinking through what are the considerations that the state needs to have in making that transition, what are the risks to the community, and what needs to happen from the side of the plans before any transition can be contemplated, to make sure that there are no gaps and no dropped balls in that transition, and that people don't lose service that are put into higher risk for institutional care or poor health outcomes. There are a lot of learning opportunities from the current delivery of community supports, and we want to make sure that those learnings are sort of front and center before we proceed with any transition. And so this recommendation is to really bring together or convene a work group to have stakeholder involvement, especially people with lived experience and advocates. I wanted to also call on Jeannie. I think you had a comment also, but I know you had your hand raised, so I wanted to give you an opportunity to talk about your comment.
Yeah, I just want to concur with what Barbara said earlier. She did an excellent job of describing the situation of many providers. And I think the state needs to be aware of this critical need that providers must be paid timely. And often the example she gave for April, May, and June is a very common example that we hear. And recently we heard a 7-month example of not being paid with all the documentation in submitted timely. So I think this reform of the payment process internally has to be evaluated in order to continue to have providers want to participate in some of these programs. So I would encourage you to bring that to the attention of the full administration so that some new process can be implemented. It's really a critical need. Many nonprofits who may be small organizations, extremely small organizations, to have to take out loans is just unacceptable. And it really doesn't matter whether you're a nonprofit or a for-profit in that regard. It should be unacceptable in our system that organizations have to take out a loan to pay or even consider take out a loan to pay. And we are aware of 2 organizations that did take out loans during recent grant processes because they weren't being paid timely. So I think that needs to be taken into consideration. Thank you.
Thank you, Jeannie. And I see also, Marty, you have a comment here about metrics, making sure that metrics include whole person-centered needs tied to outcomes, which is almost never captured. You write here that metrics now usually mean utilization of the service or support, meaning the number of hours used, and never about whether the actual need was met. And I think that's a really good comment. I'm wondering, Sabrina, if you can respond to that, if you have any thoughts about how quality measures can kind of go to Marty's concern here.
My main thought is that I totally agree. We need to see if the person's receiving the service that actually addresses the need. Marty and I both are advocates in the DD side of things, and we know that people often are assigned one service, like respite, when they actually need a service that helps them do something more comprehensive, like supported living services. Is an example that comes to mind. So yes, it needs to be both the timelines and did the person get the service? Were the hours authorized met? There's these kind of discrete numbers and metrics that you can get from someone's record. And then there needs to be the survey components, and those really need to look at the person and whether their goals are being met, whether the services allow them to live a life of their own design and access the community. And right now there's a proposal from Mathematica to create the HCBS quality metrics that all states are going to be required to use for fee-for-service Medicaid HCBS. And some of the measures have things from some person-centered outcomes measurements, which I think are one of the better models out there. So I would encourage folks to look to that model as an example, and I'm happy to share some links to what's in development right now and opportunities to weigh in on the federal level. But I'm also hoping the folks here from the state can talk about what those things can consider it. And, you know, we don't have to wait around for the federal government to order us to do things. We can also step up and lead the way as Californians.
Thank you. And Peter, did you have a comment as well?
Yes, can you hear me okay? Okay.
We can, yes.
And again, this all comes back that way. I really appreciate everyone's comments. It's a great discussion. I did want to just call out, I mentioned this a couple of times. There really isn't good systems if someone is not available. If somebody has to call off sick, somebody has a family emergency. There's not really a backup system in any of our programs to really address that gap. Okay, particularly in IHSS, we've been hearing, and we all hear it around this table, and I hear it, you know, in all parts of my life. People call me and say they need a backup caregiver. They call the backup service, and Peter, do you have somebody you can send? And I do my best to fill the need when folks call, but the backup service issue needs to be relooked at. I was disappointed when I read from the LAO that they were commenting that people were not using the system. And if I remember correctly, they actually recommended decreased funding, and it implied the service wasn't needed. And with all due respect to the LAO, that is truly not the case. People on IHSS, when someone doesn't show up, are really at risk. They call for a backup service, and oftentimes there's no one available. Or they should have known better, so it's a planned event, so they don't send someone. Or you call when someone says they're working on it, and then you call in the morning to find out if someone's coming, and you find out they aren't. People are going without medically necessary care to keep them safe in their homes. I know people who went without food, water, people who were in bed for a couple of days and developed other issues and had to go to the hospital. So again, I honor what we do as a state, and I support our initiatives, and I want to commend policymakers, but this is really an emergency need. So what I would like to see is an audit of the backup service program. I would like to know how many people were actually served, how many people were denied, how many people didn't get the service, and what is the appeal process when someone says, well, you're calling too late, so we don't have anybody, or you should have known because of the planned event. Our providers, no matter whether you're getting services from whatever system, regional center or IHSS or any aging or any other program, need to have a right to go on vacation and live their lives. And we all know there's a shortage of providers. So there really is no such thing as a planned event. Thank you. And I appreciate everyone.
Thank you, Peter, for uplifting how important a functioning and populated backup provider system is to meet needs of people using IHSS. It's really something that I hope that state agencies are hearing to make sure that the proper investments are put in place so that people can actually access the backup provider system. I think we have to move on to public comment. So I'm going to kick it back to Jackie.
Okay. Hi, everybody. We're going to move forward with the public comment part 1 of today's meeting. Again, if you're joining by phone, please press *9 on your dial pad, and I'll announce the last 4 digits of your phone number to unmute your line. You'll need to unmute on your side as well. If you're an attendee who's joining Zoom, same thing, click the raise hand function within Zoom to ask a question, and I will announce your name or either the last 4 digits to unmute your line. Please unmute as well. Quick reminder, we still have a robust agenda to cover today. So please, I ask you with dear respect, if you're able to complete your public comments in 2 minutes, that will allow us ample time to get to other public commenters. So I will look at the line and see if there's any public comments at this time. We will be doing a break after the public comment period. I'll give it just a little bit more time. I normally am okay with holding for a little bit longer, just recognizing that we are a little bit delayed on our agenda, but again, want to make sure that there's time for public comment. In the event you don't want to verbally share your comments, you can always email us at engage@aging.ca.gov. I'm not seeing any of our public members wanting to ask a comment. There will be time at the later part of the agenda to do the same thing. So again, I think we'll just move forward and take a 15-minute break at this time. I think let's return. We're right at the 11:30 hour, 11:45.
I see Michelle Rousey has her hand raised. I'm sorry to interject.
Can I take just a second? Sorry, guys. It's about the backup provider that system. You know, when we're evaluated for IHSS, we're asked, at least I was in the last couple of years, whether I had a backup provider, and I don't. And I've never attempted to use the backup provider because I know, as having been on the advisory committee and stuff like that, that system is not a system that is reliable to use as a backup system either. So it does need to be looked at, and also the compensation rate it for our providers, not only for our backup providers but for our providers, is so low that it's hard to imagine that backup providers are going to want to be there without additional funding and support to be almost like on call. So thank you.
Thank you, Michelle. All right, same thing. If we can advance to the next slide, we are going to take a 15-minute break. 11:45 is our goal to come back. When we return, we will hear from DACLAC's Housing Subcommittee on some of their priorities and recommendations that they have at this time. So thank you, everyone. We'll be back in 15 minutes. Wonderful. Thank you. Welcome back from break. I'm going to turn it over to Hagar to summarize some of the recommendations from the Home and Community-Based Services Subcommittee, and then we'll convert and transition over to learn about the Housing Subcommittee recommendations. Hagar?
Thank you, Jackie. So just as a recap, the HCBS recommends improving access to HCBS, improving long-term services and supports navigation, and implementing universal quality metrics to improve quality and remove gaps. The HCBS, improving access to HCBS will require some financial and administrative focus policies that remove those barriers, including implementing share of cost reform, expanding presumptive eligibility for HCBS, providing prompt coverage, and using projected costs and as well as allowing provisional plans of care, and then creating a stakeholder process or work group to work on HCBS delivery through managed care. Improving long-term LTSS navigation is going to require developing a no wrong door system in the long run, and in the short run, maybe while that no wrong door system is being implemented, creating a centralized resource page that has all of the information on waivers and non-Medi-Cal HCBS programs and services. And then our third recommendation around quality metrics will require implementing the Medicaid access rule quality metrics requirements, standardizing those metrics across the entire LTSS system, and then again, engaging stakeholder input into the rollout to make sure that the the quality measures ensure transparency throughout the process. So we're going to transition to Marty right now. He's going to talk about housing. And so as you are considering what we should proceed with for the day of action, keep in mind the HCBS subcommittee recommendations as well as housing, and then we'll move on to transportation as well.
Oh, I guess I'm on. So, thank you, Hagar and Sherry and everyone. First of all, I just want to do a shout out to Jackie and Sarah for the way they're running this meeting. I mentioned that in the chat, but it's really been really good and positive, and that makes a difference in how everyone participates, and it's very welcoming. So I for me as an advocate, I really appreciate that. Also, I just want to make sure that we think send our prayers and love and support to Carol DeAndres, who's with the Department of Aging and Community Engagement. They're dealing with a pretty devastating family loss, and I just want to make sure that we're thinking of them. I'm sure we are, but I just want to remind that as we're talking through these issues today, it's about people, and people's lives matter. And obviously, when I talk today about the housing issues, I'm thinking of how much Carol has been a part of all we have done and will continue to do so when she returns. I also want to thank the subcommittee members, for their help and participation through this process and working out priorities. And just to remind everybody that our priorities are not finalized in terms of whatever we're going to do in the coming year or in the coming months. As new issues develop or new details of certain initiatives come up, we're going to have to fine tune a lot of these priorities. Can we go to the first slide? And I promised Sarah that my presentation is under an hour. No, I'm just kidding. I don't want to give her a heart attack. So we came up with this, like the other subcommittees, this, 3 recommendations. Almost all of these in some way the committee has heard before. These are priorities that were actually talked about and agreed upon in subcommittee meetings held in May and June. They're just kind of categorized or grouped together more logically under a topic. So I'm not going to go into detail with any of these until the end of this presentation, to allow the subcommittee members and others to comment or to seek more information. Our first recommendation, number 1, is to improve access to affordable housing with rent subsidies and other support. We feel that this is really foundational and crucial. By the way, I want to make sure that we underscore that whatever we're recommending here is based on the issues of equity being the foundational aspect of many of all these issues, as Marina was talking about earlier, and also that data and how we collect information in terms of outcomes needs to be based on the whole person to making sure that these recommendations are being implemented properly and with good outcomes. So the improving access to affordable housing with rent subsidies and other support includes the following: implement transitional rent services under CalAIM, that's the California Advancing and Innovating Medi-Cal waiver, and similar services under other programs, including Proposition 1, and also similar services that are being proposed in the behavioral health services transformation initiatives by the Department of Healthcare Services. Number 2, expand CalAIM housing-related community supports, including housing navigation, rental assistance, security deposits, tenancy sustaining services, housing modifications. Number 3, make the optional, which is currently optional, the CalAIM's community supports services related to housing, including transitional rent services statewide. Number 4, recommend that the state pursue federal funding for a pilot shallow subsidy program targeting rental assistance for older adults and people with disabilities at imminent risk of homelessness. That's part of the Master Plan for Aging Initiative. Number 2, and lastly, recommend that remaining community care expansion funds be directed to funding permanent supportive housing and other publicly subsidized housing in the community. Let's go to the next recommendation. Recommendation 2 is breaking down silos that create barriers to accessing housing services and supports. Underneath that is develop inventory of state and local government services related to housing supports, homelessness prevention, renter protections, and more. Often, and this goes back to the point that Andrea made, was that a lot of people, whether you're an advocate or a policymaker, have no idea what another agency or what another system is providing in terms of a certain service. And in this case, housing is provided through, or is several agencies are responsible for housing in some way that crosses different departments and is also administered locally by cities and counties. And again, it's really difficult for an advocate or anyone for that matter to have a full understanding of what's out there that a person would be eligible for. Number 2, develop a no wrong door approach that includes affordable housing and homelessness prevention and system navigation. This is something that is part of the Master Plan for Aging. I believe, Sarah, you're one of the people, I think, taking the lead on this effort, and we just wanted to make sure that the issue of housing and homelessness prevention is included. Number 3, to promote equity, review state and local housing assessment tools that are used to assess housing needs and homelessness prevention. This is really, really important. There are assessment tools such as a coordinated entry tool that are used by local jurisdictions that may include assessment language that might prevent a person who is otherwise eligible from accessing housing. Lastly, recommend that the California Health and Human Services Master Plan for Developmental Services Stakeholders Committee, which I'm on, and a couple of other people on this committee that are also on, make a priority the issue of housing-related supports and services, homelessness prevention, including workers who provide supports and services, and that those issues are linked to housing and housing supports related initiatives in the Master Plan for Aging, so it's seamless. Next slide. And lastly, our final recommendation is recommendation number 3, rent cap protections. We are recommending 3 items, but there will be more as time goes on. Actually, there's 4 items because I actually didn't, something came up later, but I'll mention it at the end. The first recommendation is recommend adoption of low income housing tax credit rent cap protections applied to current properties that the California Tax Credit Allocation Committee state regulations currently have but the current regulations now have rent caps for future construction. Number 2, recommend adoption of rent protections for mobile homeowners who rent the land from park owners not protected by local ordinances. 3rd, recommend clarification of rent cap protections on residential care facilities for the elderly and adult residential facilities, and strengthening of protections from additional service costs. And there's a 4th one. This was not brought up before the subcommittee, so I'm adding it, hopefully with no objection from the subcommittee, and that is Prop 33, which is on the November 2024 ballot, statewide ballot. Its subject is affordable housing rent control, and it would repeal current state law that prevents cities and counties from enacting rent control in their jurisdictions. It's a little more detailed than that, but that is the proposition that's on the ballot in November. And that's our recommendations. And I guess to Sherry and to Hagar, if we wanted to open it up for further comments or details from subcommittee members. And again, appreciate the work of the subcommittee members and also the help that we got from others in making these priorities.
Thank you, Marty. This is Sherry again. Appreciate you running through the top 3 recommendations and sub parts of those recommendations. I know Sheila DeMong had planned on joining you in the presentation and soliciting the discussion amongst the committee members, but had a family issue to deal with. So we wish her well today, but I know that there are several other DACLAC committee members that are part of the housing subcommittee. So if you'd like to weigh in at this time on any of these recommendations or just the DACLAC members in general to comment on any of the recommendations. I think we have Jeannie up first with her hand, and then Michelle.
I'll defer to any committee members first. So is Michelle a committee member? So I'll go ahead and talk. And thank you so much, Marty. I think those are excellent recommendations. And I particularly like the very first one on transitional rent subsidies, which is such an important element to help reduce and prevent homelessness. So thank you for those recommendations. I think they're really on point.
Thank you, Jenny. And the subcommittee will hold a special meeting this month, and you're invited to join us, Jeannie, to get a overview and a briefing on the Department of Healthcare Services implementation paper regarding implementing the transitional rent services. That was actually supposed to be released, or they thought, in July, but like we all know with state agencies, things moving at a different time scale than the one that we want as advocates. But they will meet with us and provide give us time to comment and also to provide an overview on this implementation that is scheduled to happen, hopefully January 1st. So you're welcome to join us, and I'll make sure that you get the invite for a special subcommittee meeting.
Great. Thank you, Marty.
Thank you, Jeannie. Michelle?
Yeah, thank you, Marty. I really like a lot of the suggestions from the housing committee, and as we're looking at having coordination through services, I would hope that there would be some cross-pollination of information, so there is no wrong door. And I like your proposals that way, and that the whole person is talked about, and that services get coordinated, because a lot of times a provider, whether IHSS or others, are need access to that housing, whether as a consumer or as a provider. And, so some of that information should be passed along, and I'm glad to see that what you're proposing is being put forth. Thank you.
Thanks, Michelle. My fellow buddy advocate there.
Thank you, Michelle. Adina, you're up next.
Yes, I am wondering if these recommendations are already also being shared with housing advocacy allies around the state who will want to be supportive of these asks that particularly support seniors and people with disabilities. And I say this as someone who's involved in local housing action and yeah.
Oh, do you want me to respond? The answer, Adina, is yes. And actually, we probably need to step up our outreach because, like to you and to others across the state. And definitely, one of the recommendations was to reach out to the committee stakeholder group with the master plan on developmental services. But as you pointed out, it's really going to be important that we reach out to housing advocates across the state who are not necessarily members of the committee. So thank you for that. Actually, we'll make a special point about making sure that we do that. And, on an ongoing basis too, by the way.
Thanks.
Yeah, absolutely. Thank you for that reminder, Adina. Hagar, you had your hand up momentarily. Did you want to jump in? Okay.
Yeah, sorry, I couldn't
Go
find
ahead. After you, and then we have Ayoko.
Yeah, I just wanted to uplift the community support recommendation and suggest that all community supports be made mandatory instead of optional. I think that could cut across all services in the state, including both HCBS and housing type services. So I just wanted to uplift that and appreciate the recommendation.
I really appreciate, Hagar, that you saying that because it does underscore the whole person aspect of what we've been promoting in terms of equity and in terms of outcomes. And you're right, all the community support should be made statewide, and right now they're not. And so that creates an imbalance. And again, you have mentioned this before and others of accessing services. It may be available in one part of the state, but not available in the next county or the next area where that managed care plan is operates. And so it just promotes inequity when the whole concept of community supports is supposed to do the reverse. So thank you for mentioning that. It's really critically important.
Thank you, Agar. And Ayoko with the CDA. Yes, thank you.
Good afternoon, everyone. Ayako Utsumi, I'm a housing consultant for the CDA. And Marty and committee, thank you for your very thoughtful recommendations. I was wondering if the committee has thought about asking, in terms of like, new units being created, asking for a higher number of ADA units, or at least a little more universal design, asking for higher minimum. So right now, the minimum is 5% set aside ADA units in any new or substantial rehab building. And then tax credits, I understand, require a 15% set aside of ADA units. I was wondering what you thought about those numbers, if there were other proposals for minimums. Is there research or data to support those new numbers?
I don't know the answer to your question, other than it is something we should pursue, or definitely the subcommittee should take a deeper dive in, because one of our recommendations is referring to at least with the tax allocation committees caps. But you're raising a good point, because anything we can do that would help provide more accessible housing or affordable housing, and also subsidized housing to wherever in the state, is going to be something that we need to prioritize. So we'll put that on the subcommittee agenda, and I would love to have you join in, either in your role as a CDA housing policy consultant, or in your role as an advocate who is not shy about raising her voice. And we need it on this issue, by the way. So thank you. Thank you very much for raising that. And I just want to go back to the point, that Andrea made and others throughout, and Peter throughout this meeting, that whatever recommending, and even though it is something we've heard, but we got to make sure that the issues of equity and also the issues of accountability and looking at outcomes that are whole person, meaning it looks at the whole person, looks at Andrea's life or looks at my son's life and looks at the totality of his needs, which includes housing, it includes healthcare, it includes long-term services care and behavioral health. He used to have IHSS protective supervision. It crosses different systems, but it needs to look at his entire life. Do you take any one of those away, something happens bad in his life. And the state of California and us as advocates need to look at the whole person, the needs, and that the needs are met in a timely way, not whenever, it becomes available. And also that the needs are tied to an outcome so that we know whether was it met. And right now, as I said before in the chat, and thank you, Hagar, for mentioning it in your subcommittee meeting or the presentation, is that right now metrics or outcomes are measured simply by utilization, by numbers. So rather than looking at Michelle's life and whether she got the help she needed through IHSS or whatever, it's just looking at the number of dollars that was spent or not spent. I'm going to turn it back over to Sherry. Because I think somebody had their hand up.
Yeah, Michelle has her hand up, Marty.
Oh, Michelle.
Go ahead, Michelle.
I'm sorry, Michelle was talking. Take up your time.
I would really encourage, I know I'm part of that subcommittee. I just don't attend much because I've got my hands full with the other committees. But I would encourage you to get some other disabled people on it who are users of the services and do access those housing things and have lived experience of a lot of the issues. I have a lifetime of issues with housing and other support, not only because I'm an advocate and have helped other people navigate them, but myself. And so that lived experience is a great thing. And yeah, the ADA part and accessing housing units and things like that, it's not always a priority for that unit to go to somebody with actual ADA, but because it's affordable, they meet that mandate before they actually look sometimes at whether the unit is actually accessible for a wheelchair user for that need. And so and that needs to change. And so affordability and as the other speaker was saying, we need to gravitate towards a larger number of accessible and affordable housing, not just a small number. We're going to have more of a need with our seniors and growing in California. So that need's going to increase and if not triple over the next 20 years. And so we need to be looking at a high range so that the whole person is looked at. Thank you, Marty.
Hey, thank you, Michelle. And I just want to underscore that recruitment for like your subcommittee and the HCBS subcommittee, as well as the housing, is an ongoing effort. And so anything we can do to, bring on members with lived experience, providers, whoever they are, is going to be helpful. So thank you for that. By the way, I just want to say one of the things as we're looking at affordable and accessible houses or homes, one of the things that sometimes gets missed in the conversation is that the homes have to be in a safe area for people, especially, whether it's a person with disabilities or an older person. Often affordable homes or housing is put in areas that are not safe. And so something has to be done to address safety issues, not only for the person who lives there, but the support staff who has to go there. And it shouldn't be someone risking their life all the time to do those things. And our people, our community should not always be segregated in areas that are not safe. Or the state of California and local jurisdictions have an obligation to make those areas safer for people. So turn it back over to you, Sherry.
Yes, next we have Andrea and then Ayoko again. Andrea, go ahead.
Great work, Marty, and to your team. Great recommendation. Thanks to everyone. Also, I just wanted to share, so I live in the city of Claremont, and someone raised a question in regards to affordable units. Sometimes we have, the developers, the builders, they'll make maybe, I don't know, 100 units, but maybe only 5 are affordable. So again, I don't know how they reach out or how they figure out how many units are affordable. But the buildings are coming up, the new constructions are coming up, but there's not a lot of affordable units within that particular project. So I'm not sure how they would address that and how they come about deciding how many affordable units are available, but that's a big issue. Again, I know the city of Claremont, where I live, the last affordable housing that they put up was probably about 10 years ago. We do have 2 new affordable housing projects coming up and maybe more. One is for chronic homelessness, and then I think it's like 59 units, and then the other units are going on. It's going to be a lottery. So they're getting much better because sometimes they get so much funding, through the federal government, the state, and if they're not in compliance, then they can lose that money. So Claremont has gotten to the point where they don't even hold meetings, public meetings, because at this point they have to put those affordable housing available to others. And so, builders want to make them available, but sometimes there's issues within the county, cities and communities where they are blocking the progress. So I just want to mention that. And then the other thing is that sometimes services are available, but people just don't know how to access it. It just so happened I advocate a lot for myself. I do a lot of research. I have friends that know of resources and they help me. We help each other. So there are programs right now available for down payment assistance, rental assistant. The city of Claremont again have a rental assistant program. They got like millions of dollars. And so they subsidize people rent. Even those people that get subsidized from Section 8, they can also benefit from these rental assistance. And the application process is really, really small. It's really easy. So there are programs, I'm telling you, that are in place. The problem is that there's not enough collaboration so that agencies are talking to each other, and that individuals like myself don't know how to access these services because they have to go through the application process. They have to know where the monies are. And so that's the biggest issue is the outreach effort. But everybody's doing the best they can on these committees. But there are resources. I know Section 8, LA County, have a program called Open Door, and they encourage people all the time, homeowners, to rent to Section 8 recipients, and they offer down payment assistance as well as when a person move out, any type of damage they do to the property. And they have been providing that service for maybe 3 or 4 years. So again, there are program and services out there. We just don't always know how to access them, but great work.
Hey, thank you, Andrea. And I think I forgot to send your draft notice to be on our subcommittee. I remember you and I talked about, but thank you very much for your comments. We agree with that. Do want to add, you just reinforced the whole need for breaking down the silos and actually no wrong door. I want to underscore that some advocates have said, not in anybody on this Zoom meeting, that they thought breaking silos was a good thing, but they didn't think it was really, really important in terms of, other issues. And it was a nice thing to do if you can do it. I want to remind people in case that they don't understand, and I'm talking about a person with lived experience. I'm 70 years old. I'm a caregiver. My son has autism and Down syndrome. Housing is so critical and always is a challenge, but breaking the silos is damaging to people. It creates real harm. So I want people to understand it's not just a nice thing to do. If women are talking about equity, then get rid of the silos, break them down, because it is stopping families like mine, Michelle's or Andrea's or everybody else's, from getting the help they need simply because there's a barrier there. And if equity is about removing barriers or bringing help to people who need them in an equitable way in California, then you got to remove the wall that is a silo that keeps us from it. So it is damaging. I want to make sure everyone understands it's not just a nice word or a thing to do. It is damaging to people and makes a big difference whether a person is housed or not. I'll turn it back over to you, Sherry, and I'm also mindful of the time zone.
Thank you, Marty, and thank you, Andrea, for your suggestions and recommendations too, especially with regards to Section 8 and the communities that have made it easier for landlords to consider renting to folks that have vouchers by giving them incentives. I mean, it's wonderful, and that's very helpful. I'm going to move back to Ayako, and then we have Corinne. Next, we do have just a few more minutes. We're going to try to wrap up by 12:20. I did want to, before Ayako, before you made another comment, I did want to read a comment from Barbara Hanna, which fits into the issue of accessibility and universal design. Barbara states, universal design for all housing would make sense as we all age. Disability increases over time just due to aging in place. So if we had housing stock that had grab bars, easy access to homes with lack of thresholds, doorknobs with levers and without knobs, etc., those things would be extremely helpful for everyone. Then I'm going to have, Ayako, and then Corinne.
Thank you. Just very quickly, I wanted to say I learned so much in my time with CDA. Just a quick shout out to Anna Acton of Department of Rehab. I learned so much from her on this topic. So thank you.
Great. Thank you. Corinne.
Hi. Yeah, just wanted to throw in there that there's some new things that are, I call them bait and switch, that are taking place in the housing building industry. There was in California a rule, where you had to dedicate such a percentage, depending on how many you were building, of units to be affordable and low, not just affordable, but for senior housing and disabled and etc. And then there was a time when you could just pay a fee, and that allowed you to go around that. You didn't have to, you just make this donation to this pot over here that was to build specifically for that, which never got enough money to really build the adequate number of units. Now the big thing seems to be where people are building a building, getting permits and what have you from cities and saying this is going to be low income, this is going to be affordable housing. They build it, and then there somehow or other there's a little loophole in there where if it's sold to someone else, then they don't have to keep it as low income, or they don't have to keep it as affordable. And we need to really be on the watch for these things. Here in Santa Cruz, where I live, which is strapped every day of the week for housing, we have a 77 unit displacement coming up, where an entity had bought and they committed for a certain period of time that they would be affordable and low income. And now that time is running out. And we have older adults, the average age of 80 next year, that are going to be without some intervention kicked out into the street, because here an average I think it's an average bachelor place is $1,800 a month. Heaven forbid you want to try to find a one bedroom, because now you're looking at $2,500 a month. And if you're talking about somebody that's on Social Security and with a little small pension or whatever, it is totally outpricing them. So part of the reason these folks have been able to do this is because it was little known, but it was written in there that if they sold the property to somebody else, they could, so to speak, the new buyer could now do whatever they want. Well, the somebody else that's bought the property is a member of somebody on that board's family. Little tricks. And so we just, if those of us that are sensitive to housing and what's going on, I don't know if we need to convene and kind of, maybe get to the Attorney General or somebody, but these things need to be really paid attention to, because they're going to make bad situations worse.
Thank you, Corinne. As always, I think that goes back to some of the work that we are doing as a subcommittee, but as a committee, about accountability and actually measuring outcomes, because that goes back to, is a state law or policy or initiative working? And you just mentioned a way, a problem, that is happening where people might be getting around it, and therefore the outcome is not helping the people that is meant to help. One thing, and before I turn it back over to Sherry, the timekeeper, you're trying to be on time, right? And so is Sarah. I'm looking at Sarah. She's looking at me. No, but Sarah, actually, I'm just tossing this back over to your question. All the recommendations made here, the three, recommendations, as well as in the other subcommittees, is it possible, or maybe it's not even a question, it needs these subcommittee priorities recommendations, not just the one that's going to the day of action. It needs to be transmitted over to the master plan for developmental services formally. And the whole idea is so that the master plans that everyone's working on, it contains elements of the same population groups. So that so this is our contribution in helping to break down very slowly the silos, so that what we're doing over here is something that they understand and will be done over there. And I don't know exactly what the vehicle or if there's a letterhead thing, or you just write it, or you have a Twitter account or X account that you can just send it. I don't know, but whatever way it needs to formally get over there. Okay, thank you.
Absolutely. I think a couple things. We agree that, there's so much intersectionality and we can't operate in silos. And we're so pleased to be working closely with DDS on a few initiatives, one of which is a community of practice across aging and developmental disabilities to try and be better streamlining our work across the two populations, sharing resources and information, as well as our broader No Wrong Door initiative. And we have a state leadership council that DDS is part of. We've also met with, Victor Duran, who's just done a fabulous job of engaging people through the master plan for developmental disabilities. And I'm happy to forward along, all the recommendations that we've gotten from the committee just for his reference as they're embarking on their work. So that shouldn't be a problem. Thank you for the idea.
And end your letter by saying, do these things. Okay. just
no
an
comment
idea.
to that. No comment to that, but we appreciate all of this great work that you all have done. And it will be used to inform our thinking internally as we advance the next iteration of the MPA. So I'm going to turn it back to Sherry now as we move to the transportation subcommittee.
Thank you, Marty. Thank you, Sarah. Before we transition to Michelle, just on the high level, want to repeat the three top level recommendations. One is access to affordable housing with rent subsidies and other supports. Two is breaking down silos that create barriers to accessing long-term services and supports, including housing. And three is rent cap protections. Those are the three main categories coming out of the housing subcommittee. And now I'm going to turn it over to Michelle, who is the chair of the transportation subcommittee. Go ahead, Michelle.
All right, thank you. Can you hear me?
We can, perfectly.
Awesome. All right, thank you. And I want to put a shout out to Adina Levin and Leo from Seamless Bay Area for helping me be able to manage being chair of the transportation subcommittee, and where a lot of the background work is done for the group. So thank you. And so the subcommittee, the background for California Integrated Travel Project, CALIP, making transit travel payment simple and more cost effective. The CALIP enables open payments, pay with credit card or a debit card. Bullet 2, CALIP Benefits is a free web application available to transit providers to help automate eligibility verification and enrollment for people receiving reduced fares, making it significantly easier for older adults and people with disabilities to receive and use discounted transit. Meaning they'll be able to access their discounted fares on the different transit. The CalIP is also working to standardize eligibility requirements across the state, as different jurisdictions have a varying qualification policies for discounted fare programs that make it confusing and time-consuming for users. Next slide. Thank you. Recommendation 1. State level policy. Caltrans sets standard statewide definitions for eligibility for benefits. Create a single statewide digital source of truth to determine eligibility. 3. Require transit operators that receive Transportation Development Act, TDA, state funding to honor eligibility from a centralized service alongside their existing processes. Create a standard definition of caregiver to streamline provisions of benefits to caregivers. Continue to allow cash payments unless there is obvious, I can't even say that word, sorry guys, obvious and convenient options for the unbanked and underbanked. Recommendation 2, regional, sub-regional policies. Local transit agencies support open payment and eligibility verification. Regional network management authorities require agencies to honor eligibility from a centralized source.
Thanks, Ms. Sheldon. We want to have some of the rest of the transportation subcommittee members add to any additional information to those 2 large scale policies.
Yeah, if any of the members from the committee would like to speak on any of these, that would be wonderful at this point in the discussion. And if members have questions that we can answer, that would be helpful too.
Wonderful. Okay, before I open it up, we do have Sylvia with her hand up, but I want to give a chance to subcommittee members to speak first. Adina, go ahead.
Yeah, I think that there was a slide that was extremely unfortunately omitted from the presentation, which was our committee's top recommendation. Our committee's top recommendation had to do with funding. A major barrier to improvements to accessible transportation in the state of California is not only a lack of funding, but even a lack of knowledge of how much the funding needs are for the system of accessible transportation in the state of California. There are 2 different statewide initiatives that are happening right now, required by state law. One is required by Senate Bill 1121, that is assessing the full cost to operate and maintain our full transportation system in the state of California. And the second is Senate from a Transit Transformation Task Force required by Senate Bill 125, that is looking in particular at the funding needs of the public transportation system and policy recommendations to improve the public transportation system and increase usage. And the top recommendation from the Transportation Subcommittee is to ensure that these 2 state initiatives focus on assessing the funding needs for accessible transportation in the state of California, and that use previous studies done in the state to make policy recommendations to improve accessible transportation and provide funding for these. And I can provide the slide that had those recommendations. I do not understand why that was dropped out, but making sure that we know the funding needs and that funding assessment is done, incorporating accessible transportation, is our top recommendation.
I just want to jump in, Adina. I am very, very sorry. I take responsibility. I think that I was trying to like streamline the slides, and so I misunderstood that slide, but happy to update it with you, and we can make sure that the final slides that are posted reflect that. So appreciate the clarification. It was certainly unintentional. So thank you. I thought it was background information. I didn't realize that.
No. We had 2 recommendations. One was the funding, which was the big one, and the other one is the Cal ITP, the payments and benefits, which is, good and helpful, but the funding, the lack of even knowledge about funding is a big blocker toward anything else.
Thank
Great.
you.
We will resolve that. Thank you.
Thank you so much.
Yeah. Okay, so do we have any other comments?
Yeah, we have Sylvia coming up here with FCSN. Sylvia, go ahead.
Hi, this is Sylvia Yim, the Executive Director for Friends of Children with Special Needs, aka FCSN. And thanks Michelle and Adina and the subcommittee. This is such very important. I mean, every subject we talk today is very important. And I think transportation is also the big component for HCBS, because HCBS is so focused on community integration for the people with the disabilities. And without the access, for using just public transit in the rural area, like we are in Fremont, that would take an hour for us to get on the bus. And then, go to the place. You probably need to catch 3 or 4 buses before you can get to the place you want. And by the time you're coming back, you're just on the bus. You're not going anywhere. So I really think that's very important with a combination with HCBS for transportation opportunities or the options, like you say, the funding, the resources, extremely important. Second comments I want to have is more for emergency. FCSN ourselves, I had applied grant from Caltrans 5310 grant, which we receive about right now about 10 vehicles for with a wheelchair accessible. And I think during emergency or disaster, I mean, we know right now it's a fire seasons or earthquake, California earthquake area. And how do we coordinate all these, resources during disasters or emergency, how the community can help besides relying on the public transportation on that. And I think that's very important components should be put into the plan consideration. Thank you.
Thank you so much, Sylvia. Do we have any other comments? And I think we do have a representative from Cal STA who has joined us on our meeting today. Would you like to speak to some of these policy recommendations?
Hi, everyone. My name is Jimmy Tran. I'm representing the California State Transportation Agency, CalSTA. So I was not part of the discussions on the subcommittee, but I'm more than happy to bring any of the recommendations back to our team since we work with Caltrans and the California Transportation Committee team. So whatever questions you may have, anything I can support, happy to bring this back if there needs to be any additional conversations in the near future, especially at the next subcommittee meeting.
Thank you, Jimmy, so much for being here. What I can do is work with the stakeholders to get the final slide deck to you all. We did send the current slide deck, but we will update it and send it back so that you have it, and then appreciate your offer for additional conversations, and we'll follow up on it.
Thank you, Sarah.
We've been doing a lot of work in the subcommittee with CalSTA and other partners with the state transportation. And so I just really want to thank everybody for their time and their patience while we work with them to clarify. And these recommendations are just wonderful, and the group has worked really hard to get to them. So thank you.
Okay, this is Sherry again. Any other questions or comments for transportation? Sylvia, I see your hand back up, or is that you hadn't put it down yet? Do you have your hand back up? No. Okay, great. Adina.
Yeah, so I had a reply to Sylvia, which is that by being based in Fremont, Sylvia, you may have already had a chance to review the coordinated plan for human services transportation that MTC is working on. And that does include some specific recommendations about aligning with the 5310 funding and also about the transportation for people with disabilities and seniors in emergencies. And so you may already be following that.
Yes,
That is terrific. And in the interest of having some of those policy recommendations potentially supported statewide, we were planning on bringing the staff person to present to DACLAC transportation in an upcoming meeting as well.
Thank you.
Excellent, thank you. Hagar.
I just have a question for you about whether the Transportation Subcommittee has any thoughts around different strategies that need to be more region specific. I see that you have the regional recommendations. I'm thinking more about addressing the needs of rural communities, and if you have any thoughts on strategies or areas that the state can be thinking about on addressing those needs in areas that are, geographically more sparse.
I have a comment on that, Hagar. We've been working with the Interagency Equity Committee for Transportation for the state, and they've just started some of their subcommittees, and so some of the different areas, one of them is disability and different things like that, and some of that can be brought through that committee, as far as rural accessibility and equity as far as transportation that way. And I think that's something that committee has been working on, and we have been jointly working with them over the last few months to coordinate some of our work so that it aligns with not only our master plan on aging, but also some of their priorities.
Thank you, Michelle. Right, any other comments? Otherwise, I will reiterate the 3 top recommendations coming out of the transportation at a high level. One is the priority is funding to ensure that the 2 state initiatives, Senate bills that Adina had mentioned, SB 1121 and SB 125, focus on assessing the actual needs throughout the state for transportation and utilizing recommendations to ensure policy, recommendations and changes that include equity and access for older adults and people with disabilities. And then number 2 is includes state level policy recommendations, and number 3 is regional, sub-regional policy recommendations. I'm going to bring Hagar back in here to lead us in a summary discussion about hopefully having some consensus on the top recommendation from each of the subcommittees to move us forward to our day of action. Hagar?
I see Adina also had a comment. I'm assuming, Adina, you want to also raise the missed recommendation? Oh, you're on mute.
That was the first one that I mentioned. In case
Yeah,
you want to add more stuff, Adina, please do.
Yeah, a little clarification on the second recommendation. Those were both about the utilizing the Cal ITP project to make it easier to be eligible for benefits and to pay for accessible transportation.
Right.
Thank you.
So just as a recap, we're going to I went and muted myself. We need to all of us gather and come up with our top 3 recommendations for the day of action. So I think it would be useful if we sort of open this up to the committee members to have a discussion about how you view the 3 subcommittees working together to create a holistic holistic and accessible community living strategy. So to that end, just as a recap, Housing Subcommittee recommends number 1 recommendation is the removal of financial and administrative barriers to improve access to HCBS. Number 2 is improving LTSS navigation, and number 3 is improving quality metrics. And then I think if we think about the Housing Subcommittee recommendations, those kind of fall in line with the same themes. We have the recommendation 1, which is improving access to housing with rent subsidies and other supports. The second one is to remove barriers that are impeding access to housing and supports. And then the third recommendation is around rent cap protections to protect and stabilize housing. And then I feel like I'm going to do the transportation subcommittee a disservice, but maybe Adina, you should summarize it for me so I don't screw it up.
Okay, you wanted me to summarize
a high level summary, yeah, so I don't mess it up because I don't want to.
All right. Highest level summary number 1 was making sure that the state's twin assessments of transportation needs account for the funding needs of accessible transportations for seniors and people with disabilities. And the second were about recommending implementation of the California Integrated Travel Project capabilities for streamlining eligibility for benefits and making it easier to pay.
Great. So I'm going to open it up to committee members. I see Jeannie has her hand up, and ask that you maybe weigh in on how you view what recommendations do you think would go together to create this sort of interplay of transportation, housing, and HCBS that we can come forward to in the day of action, or if you have any other thoughts on any of the recommendations and how we should zero in on our top 3, that would be great as well. So Jeannie, did you want to get us started?
Yeah, thank you so much for that. And I really appreciate all the work that the committees have done because I know it's a lot of work. I want a clarifying question and then a comment. The clarifying question is, are those in rank order? So number 1 of housing, number 1 of the other 2, are they in rank order? And if so, a recommendation might be, if that's the recommendation and we only can do 3, then I would suggest making it as simple as possible because the committees have already been working hard on these. And then the second thought would be in combination with the other committees, will these, if these are going to be kind of socialized with the other committees, there might be overlap with some of their recommendations. And perhaps we want to think about what is the outcome we're trying to achieve. So at the day of action, are we just going to be talking about all of these in a sentence like we have today? Or is there actually going to be an outcome, or will this go to the impact committee for consideration for their year's goals? So did that make sense? It was kind of 3 parts there, but I think it might be helpful to have some clarification.
I appreciate it, Jeannie. I think I can speak for the HCBS subcommittee to say that, yeah, our recommendations are actually in order of preference. I don't know about housing and transportation. Does housing or transportation want to weigh in about how you presented yours? All right. So housing is also organized in terms of priorities, and then transportation.
On transportation, the funding assessment is 1, and the Cal ITP eligibility and payment were 2.
Good. And this is Sherry again. Unless Sarah would like to weigh in on Jeannie's question, and that's extremely helpful about outcomes and impact. I think the committees are working on or will be working on an outcome and impact statement or goal for the particular goal that this committee decides to move forward for each of the subcommittees. So that's definitely really, really important that we have an end outcome in mind for each of these. So thank you for raising that. Sarah, did you want to add anything more?
No, I think that's a great recommendation. And, I think that we can take, if you all are able to convene and just kind of clarify or confirm, maybe either through email following or by a quick check-in call with each other about what you want to elevate as the final 3 recos, that would be great. However, we also have no problem taking internally at CDA all of these 9 recommendations to have on record so that it still informs our thinking. It's not like we're just going to forget them. So I think that's the really important thing. It's just more a way for you all to have a consolidated, concise way of presenting what the highest priorities are at the day of action. So I hope that helps.
I appreciate that. Yes, it does help. Michelle.
I like that, Sarah, what you just said. And you know, making sure that there's clear outcomes coming from the subcommittees that we want to happen on the day of action, to be able to pass that information to consumers in a timely manner and in a way to help them advocate for these things when we get to Sacramento. And I think logistically, I would really like to see some outreach training done of some of our consumer folks for that day of action, so that they get under their belt some of the knowledge that, and or partner with somebody when they do this day of action.
Great suggestion. Thank you. So Jeannie had suggested that we, as a committee, support the number 1 priority of the 2 or 3 that were shared, at least for this year's day of action, as a short-term goal for each one. Does anybody else have any thoughts about that, or everybody feels supportive of that recommendation?
Do a roll call of members. That way we can get a yay or nay and have it on record by chance. I don't know if we do that with this group, but it'd be nice to be able to confirm with everybody yes or no. But I'm all for it. What the recommendation is for that. So thank you.
One quick suggestion is, due to time and we need some public comment, is that we could for now track that as the consensus. However, you all, if you can confirm by email and do your official finalization of it, either by email or by a meeting, that way you all feel like, you know, when it's all submitted to the state, that you're all on the same page about it. That's just a suggestion given timing.
I think it's a good idea. And if you can send the roster for all the committee members, maybe we can get like a 30-minute call just to make sure that everyone's on the same page. Maybe Sharon and I can prepare the top 3 recommendations, maybe under themes, so that it's kind of easier to go through as well.
Yes, we will follow up with you to make sure you have the full roster of all emails and the members on the committee. Thank you.
Thank you.
Wonderful. Thank you. Okay, I'm gonna send it back to Jackie now for opening up for our final public comment time. Jackie, if you're speaking, you're muted. You're still muted.
Here we go. I was trying to find my spotlight for my video, so my apologies. So we're going to go ahead and take a few moments for public comment towards the tail end of our meeting before we move forward with closing remarks from Director DeMorris from the California Department on Aging. With regards to public comment, as a reminder, if you are joining by phone, press 9 on your dial pad and I will announce the last 4 digits of your phone number and unmute your line. You'll need to do the same on your side. If you're joining by webinar, please click the raise hand button to join the line. And again, I will announce the last 4 digits of your phone number and unmute your line. I again respectfully ask that you keep your public comments to 2 minutes to allow ample time for individuals who are in the queue to make public comment an opportunity to do so. I see a public comment coming from Kevin Rath. I'm going to open up your line, Kevin. You'll need to unmute yourself as well. Hi, Kevin.
Hi, can you hear me?
Yes.
Oh, thanks. And thanks for this. This is very informative. I work in the IDD community, but I'm also looking at aging services. And I want to encourage everybody too, when we're talking about outcomes, to try to figure out, as we do that, what we can do to measure these outcomes. So when we're defining outcomes, include measurable aspects. It's not the only thing about an outcome that's important, because personal experience sometimes can't be measured. But if we can try to think about that. One of the ways to do that we've been working on at Tempo, the company I work with, is focusing on goals and figuring out outcomes in terms of not just individual goals, but also individual goals that can be aggregated into general goals. Thank you.
Thank you for joining today's meeting and providing that comment, Kevin. Others on the line, feel free to raise your hand or press *9 if you're joining us by phone. I'll give it a few more seconds. In the event you prefer to do written comments, you may send those to our inbox. That is engage, ENGAGE, at aging.ca.gov. All right, I think we are good to move forward. I'm going to send it over to Susan. Let me find you first, Susan, so we can spotlight you and so you can close out today's meeting.
All right, Jackie, thank you so much. And to our co-chairs and committee members, thank you. This was an incredibly productive and engaging meeting. This is a prolific group, and there's so much evidence on the slides and in the conversation of the tremendous work that's happening between meetings. Thank you. Thank you. Just excellent, excellent work, DACLAC committee members. I want to especially thank Director Joe Xavier, my state co-chair, for opening our meeting and joining today. And if you're not following the participation, you may not know that today we had representatives from CalVet, Department of Healthcare Services, state hospitals, Department of Social Services, Department of Developmental Services, the Office of Emergency Services, California State Transportation Agency, the State Council on Developmental Disabilities, State Assembly, and State Senate. So I want to thank all of our state partners who've joined us today. Thank you all very much for your attendance, for listening, and your leadership. And then I especially want to thank Hagar and Sherry for working with the 3 subcommittees and serving on the subcommittees, not just stewarding the work, but participating in the work and leading us today. And then Hagar, Marty, and Michelle, and all of your subcommittee members, thank you for your contributions and for elevating the issues and presenting them in such a way. And again, apologies on the transportation slide for the oversight. We will correct that. But for elevating the issues and being so clear in how you articulated the priorities. And then for committing to yet another meeting so that you can help prioritize for the day of action the 3 top priorities of DACLAC. And as Sarah Steenhausen noted, if it doesn't make the top 3 priorities, it doesn't mean the work is lost because of all the people listening today, as well as our ongoing role. And, we'll be returning quarterly to this group. So thank you for the extra time it takes to make those 3 priorities. And it's working so well. We hate to switch things up, but it is our practice that every 2 years we do rotate leadership. So we will be looking this fall at new stakeholder co-chairs and subcommittee leadership. So my thanks. This isn't the last time you will be thanked for our leadership, but if anyone wants to step forward, is interested in serving in a leadership role, please do let us know. We will see all of you October 8th, I hope. So I hope everyone, if you haven't yet registered for the Day of Action, that you will, and that we will see you, if you're able to be in person, that we'll see you in person in Sacramento. And then all of the materials from today will be available on our website, including the recording. I apologize. I was at the 988 Policy Advisory Work Group and missed the beginning of the meeting, but I will be looking at listening to the recording to see what I missed, and you can share this with others. And if you had to miss part of the day or we breezed through some of the content, you can find it all on the agency's website. So that concludes my remarks. I think in the chat we had, let's see, did Claire Ramsey have a comment? No, did I miss? Was there anything that I left off?
Just putting in the IHSS consumer survey results so everyone had them since they're public.
Oh, great, Claire. Thank you so much for sharing that.
Thanks for the great meeting.
And Jackie, back to you, to our CDA team. Thank you for organizing another great meeting, all of you.
See everyone this fall. Have a great afternoon.
Thank you. Bye.